what I'd like to do next is to talk about another study you have, which I was fascinated by. I think that's one of the first reasons that I reached out to you, because it was about atrial fibrillation in patients that maybe didn't have fatty liver disease. And so, my perspective was, wow, this is great, because it actually is going to give a heads up to people who never would have suspected that they have an issue like cardiovascular atrial fibrillation like that. And so I would love it if you could share that study with us now.
Thank you. Thank you, Mike, for the interest in this second study. I need to share my screen. All right.
There we go.
Yeah, so this is another interesting study on liver stiffness, fatty liver disease, and also atrial fibrillation in the same Rotterdam study. And that was recently published in the Journal of Hepatology. I have nothing to disclose. And again, yeah, fatty liver disease, as we know, is present in more than 1 in 4 patients globally, and has become one of the leading causes for advanced liver disease like cirrhosis and hepatocellularoma, and thereby become one of the leading indications for liver transplant as well. And it's well known that fatty liver disease has been linked to impaired cardiovascular disease, or impaired cardiovascular health, actually. And the risk of cardiovascular events is almost tripled in these patients. When we go, or when we zoom out a little bit on liver health, you see on the left a normal liver. The yellow bright liver indicates a little bit of fat in the liver, at least more than 5%. And if the fatty liver is present for a prolonged period of time, you can develop scar tissue, which is known as fibrosis in the liver. And when the scar tissue takes over the liver, and also the function of the liver is impaired, you can, or we call that liver cirrhosis. And throughout this disease spectrum, we know that the stiffness of the liver increases, and therefore the liver stiffness is an important marker for us in disease management. A little bit about liver stiffness before I continue in the study. The liver stiffness has become an important tool to rule out fibrosis, and values below 8 kilopascal is what we consider normal, or at least low risk of fibrosis. And at the right, you see the probe that we use to measure the liver stiffness. And in liver patients, it's a quite accurate tool for the fibrosis assessment. However, there are also other abnormalities that might increase the stiffness of the liver. And when you have, for example, an outflow of obstruction of the liver, you can imagine that the pressure in the liver increases, and is also measured by this device, but it does not reflect fibrosis per se. So that's something that we should take in mind, that liver stiffness is might not be only fibrosis, but another issue. With that having said, I think we should go to the aim of the study that we performed, and that was to investigate the relationship between fatty liver disease and liver stiffness with prevalent and incident atrial fibrillation. Well, we used the Rotterdam study, and in this particular study, we could include almost 6,000 participants that had a mean age of 70 years, and they all underwent abdominal ultrasound, transient elastography, and cardiovascular assessments. And besides the baseline assessments, we also had 2 years of follow-up data on these patients, but this was only among a subset of 5,000 participants. So to get a little bit of feeling with the patients or the participants we had in this study, almost 70 years old, 40% was male, a BMI of almost 28, and metabolic syndrome of 50%. So metabolic dysfunction was quite common, and 36% had steatosis. Also cardiovascular health, as you can expect in this rather elderly population was common. So coronary heart disease almost 10% and heart failure 4%. And at baseline, 405 patients had atrial fibrillation, and in the short follow-up period we recorded 132 incident cases of atrial fibrillation. So that brings me well to the main question, that was whether fatty liver disease, and we use different definitions, was associated with atrial fibrillation. And here we have the results of this question. So here, well, illustrated is the odds ratio shown, and an odds ratio of 1 means that it's no effect. An odds ratio lower than 1 means that it might be protective, and an odds ratio above 1 means that it is an increased risk. And as you can see, the odds ratios are pretty close to 1, indicating well, that there is at least not an increased risk, but also not a significantly decreased risk. So, and the results are quite similar for steatosis, NAFLD, or MAFLD, which are different definitions of the same disease. And we obtained similar results when we looked for incident atrial fibrillation during our follow-up periods. So that brings us to the conclusion of the first question, which is that steatosis, NAFLD, and MAFLD were not associated with atrial fibrillation. And then we had also several secondary exposures and outcomes and other things we were interested in. And one of them was liver stiffness and atrial fibrillation, as shown above, and below is whether there was whether the cardiovascular health could have impacts on liver stiffness. To get the first question answered is again here the results. Again, we have an odds ratio, and now the odds ratio is far above 1, which means that then patients have a liver stiffness above 8 kilopascal, so which is too high for a normal liver, means that these patients with high liver stiffness have twice the chance of having atrial fibrillation compared to patients with a low liver stiffness. So that brings us to well, this conclusion that liver stiffness increases the risk of atrial fibrillation or vice versa by almost 2 times the risk. And then for our final question, whether the associations with the markers for venous congestion with liver stiffness were present, we have this table. And I want to note that we now no longer have odds ratios, but betas, which means that patients with heart failure have 1.75 kilopascal higher liver stiffness than patients without heart failure. And similar things were observed for patients with dilated liver veins or dilated inferior vena cava. And this seems rather low, but this is the increase per 5 millimeter of the inferior vena cava and can extend to quite a lot. So what we have shown here is that the markers of venous congestion may increase the liver stiffness, while this is not per se reflected by fibrosis. So that brings me to the last conclusions, which is that cardiovascular health, and we use the markers heart failure and liver vein diameter and inferior vena cava diameter, may increase the liver stiffness. So that brings me to the conclusions and key messages of this study, which is that among community dwelling elderly, fatty liver disease was not associated with atrial fibrillation, but atrial fibrillation was twice as common in patients with high liver stiffness. And that is important because but it's unclear by what it is caused. We believe that venous congestion instead of fibrosis may explain the association between liver stiffness and atrial fibrillation. and that is supported by the findings of heart failure being associated with high liver stiffness. And another point, high liver stiffness in the absence of liver disease may be due to cardiovascular disease. And this is important because several referral strategies now use liver stiffness-based screening, especially in untargeted population. This may detect cardiovascular disease and may therefore require cardiovascular health assessment together with a liver health assessment. Thank you so much. And I will stop sharing.
So Laurens, okay, thank you for that incredible eye-opening research, really. And so I have some questions with that too. There was the other paper that we discussed with you. I'm going to challenge you for a second. Maybe I shouldn't start with this, but so if your conclusion on the paper with regard to fatty liver disease assessment and people over 65, which you define as elderly. I'm not sure it's elderly as you start to get older yourself, but maybe I still think that's young. But anyway, if that's the case, then you would be missing a lot of the like the opportunity of identifying patients that do have cardiovascular risk based on liver stiffness, correct?
Yeah, that might be an issue. However, atrial fibrillation is also a disease that is common, well, maybe not solely in the elderly, but it's very rare among those below the age of 50. So below that age, it would be very difficult to perform this study because there would not be cases with atrial fibrillation. Right. So we might have missed on a few patients, but as it is most common in the very elderly, so above 80, but also it is already present above 60. Yeah.
So just to be clear, I don't want to make the wrong assumption here. So would you say, this is not on the formal statements in your conclusion, but would you say then, well, you did say that the multidisciplinary approach is appropriate, because that's something that everybody is talking about, that, you know, primary care physicians should work with cardiologists and of course gastroenterologists, hepatologists, and so that there are going to be discussions about patients and patient care in those groups. So this would support that. That's the first thing. That's correct. You agree with that, right?
No, I think it's really important to do multidisciplinary care, especially when you have high liver stiffness. The chance is equally high that you have a cardiovascular disease than fibrosis in an untargeted population.
Okay, and is it, and for people that are watching this too, to answer this question, is it possible that the assessments would include a high score on the liver stiffness and yet have a low score on the steatosis, on the fatty liver part? Is that possible?
That is possible. Yeah, that is possible.
Okay, so, and if in that case, somebody went for an assessment and they had a low steatosis score, so they had low fat, but the liver stiffness score, right, which would be the fibrosis score translated, right, would be high. Those would be the patients that should be for sure referred to a cardiologist. Is that right?
Yeah, if you have ruled out other liver diseases like viral hepatitis and so on as well, then I think well, you should repeat the measurement, but also consider referring to a cardiologist for further assessment. Yeah.
So would you be as so bold as to say that that this approach might actually save lives by detecting atrial fibrillation in patients that would not have known?
Well, that's a difficult question. I think that transient or the liver stiffness-based screening might detect more than just liver fibrosis, but also cardiovascular disease, and that might saving lives. Yeah.
Well, with a higher prevalence, as you said, right? It was more than 2 times, I think, that it's that there would be patients who had no idea before they had this scan done that they're at risk.
That's true.
So I guess my point is to say that if we were going to apply this research, and has this been replicated in other studies that you're aware of as well?
I know that a very small study also demonstrated that the liver stiffness in patients with atrial fibrillation was higher, but that were patients and not the general population. But they found, well, supporting results at least.
Okay.
Yeah.
Well, thank you. That's great, and I appreciate that. I'm looking forward to seeing these presented at ASLD that's coming up soon as well,
Hmm.
right?
Yeah,
So thank
would
you
be
so
nice.
much. And we're going to do this again because I know as a young investigator, you are so passionate that you're going to have lots of other really breakthrough research to share in the future. Is that
Look,
correct?
yeah, that should be correct. Yeah, thank you so much for the invitation, and it was an honor to be here. Yeah.
Righty. Thank you.